I'm Dr. Jayakrishan, Group Medical Director of Triyog Ayurved Hospital. As explained earlier, we have started the initiative to take Ayurveda to the public at large. Fortunately or unfortunately, it was a system gradually alienated from the public. Now our effort is to see that Ayurveda takes a central stage and act as a main healthcare system. From the Ayurveda point of view, as I explained earlier, we have a curative aspect, treating with the diseases with natural remedies, herbal preparations and all. Along with treating the diseases, we also have an advantage of preventing diseases by promoting the health in the natural way. That includes your lifestyle adjustments with food, activity, sleep, and adjustment according to the seasonal variations. With various things, we ensure that your physical health is established. So you are getting prevented from going towards a disease mode unknowingly. When a structure or a organ is damaged and its functions are impaired, then only we call it as a disease. So much before the structure is damaged, we are able to identify and we are able to prevent that also. Possible disease manifestation can be prevented, and this will be much beneficial to the people in vulnerable ages like children and old age people. Children, since the health is very low, our medicines are only herbal, natural medicines. We can easily promote their health, especially in chronic diseases like cold, cough, frequent fevers and all, no, where we improve the system and the symptoms will disappear. Old age, same is the case. Naturally your structural health is going down. Our options to improve the structure, support the structural health will be very easy because we are using only general basic herbal preparations. It cannot damage the system further. So our preventive and promotive aspect also will be contributing a lot in creating a healthier society. Apart from the general management of diseases, especially chronic diseases, degenerative disease like cancer kind of things, rheumatoid arthritis. Nowadays we all know that most of diseases are introduced or induced by the stress related activities, etc., anxiety, tension, agitation kind of things, which can have a weakening impact on the nervous system, and subsequently diseases are coming. So in that areas also we consider the body as a single unit, where the physical plane is considered, deep to that it is a mental plane. So wherever the mental plane is also involved in disease formation, we are effectively managing the physical health as well as the mental health. It's not the mental disease, it may not be a healthy mind also, still we can manage a pleasant form of mind which can contribute to the cure of any major disease like psoriasis, skin diseases, rheumatoid arthritis. Most of the diabetes happening at an earlier stage nowadays. 30s people are getting diabetic, mostly stress induced. Such conditions, stress related impact can be well addressed in the body, where cure or management of the disease become easier. In spite of having a disease, we ensure that you lead a healthy life, a pleasant life in spite of the disease, because we always look for supporting the healthy structures in the body, and we are able to create it just like the food is creating the health. A fortified form of food or herbs we are introducing, for which we have different understanding of health and diseases. So our way of looking at the health is little different, and holistic way of treating the body as a single unit makes everything different, and we are able to create a healthy status for the individuals, which will contribute in a long way, which will contribute in creating a healthy society and a healthy country there. Thank you.
Whatever Dr. JK said, to achieve that, we would like to make our presence in each community. Means public should have accessibility to Ayurveda hospital. Basically, the visibility to be created so that whenever they feel, even for a cold cough at home, they should come to our hospital and get the treatment done. If they come at 16, 17 or 14 years of age for a cold cough, we will ensure that their entire body structure will be protected and maintained for the future for long without any congenial issues. That's how we are thinking. My intention is to see that this hospital should be present pan India across and accessible to the regular communities easily. So that's how we are creating our hospitals on the mainstream. That is our intention and motto of Triyog Ayurved hospitals. Ayurved hospitals, we have two in Chennai, two in Hyderabad, one in Visakhapatnam. That two in Hyderabad and one in Visakhapatnam was purchased by Triyog Ayurved hospitals. Those two promoters were here and they are part of our Triyog Ayurved hospitals. They are even on board of Lakshmi Rajyam Healthcare Private Limited, which is a parent company. So we all, this 5 team is going to make a Triyog Ayurved hospitals felt and present across pan India. This is the intention and motto of our Triyog Ayurved hospitals. Already Dr. J.K. sir and Dr. G.K. Reddy sir said, we have been in consultation with the allopathy doctors. Even I myself worked in allopathy hospitals for almost 24 years at Global Hospital or Fortis or Vasani Care everywhere. So it should be like hand in hand. But at the age of 15 or 16, if any patient comes to hospital, Ayurveda hospital with cough or cold or fever kind of a problem, the Ayurveda medicine will provide them to create entire body healthy. It's not that only one portion. It's not that fever tablet, if you take it, that will be subset. So what he means to say is, entire structure can be protected with the Ayurveda herbal medicines. This is the intention. And Dr. G.K. Reddy sir also said that there are some company hospitals which have a tie-up with Sri Visishta hospital, that after chemotherapy is done in oncology hospitals, patient has been directed by the doctor themselves, allopathy doctor themselves, to our hospital to ensure that the quality of a patient and for the extension of life, these two to be done by the Ayurveda product, and it has been found successful up to 70%. So that life and quality will improve. What else anyone requires? If somebody is going to die in within 1-2 months time and stays for almost a 10-year or a 4-year period, it's a great miracle only. So Ayurveda has got that. So we would like to ensure that accessibility to be created. Yes, as you said, every medicine is important. It is not that that medicine is necessary, this medicine is necessary. Everything is very, very important. All plays a major role. But Ayurveda also will give you a strong foundation of a body without having any side effects.
We have curative also, preventive.
To include yoga also,
In long run, we will use yoga also as a system to maintain the health.
yes, because Gunabhai Mal means people
Yes.
have the habit to.
These two are trained in yoga. The fellowship, PG diplomas in yoga. We have instructors now available in the system.
In Hyderabad, we have naturopathy doctors also as a consultant.
Naturopathy doctor
Physiotherapy also.
Shabana,
Even, yeah,
Sunita.
And
You are
one
saying
thing,
something.
first of all, we need to tell people is what are those causative factors. Diseases is everybody knows diseases and all. What are those particular disease causative factors? We need to educate the people. Then only people get rid out of that particular disease. Medicine, treatment, and all are secondary thing. First, we need to educate causative factors. First, we educate the Nidana Parivarjana. In Ayurveda, we say the first word is Nidana Parivarjana. That is the first. Yeah, that is the first line of treatment is Nidana Parivarjana. Means causative factors. Eradicate the causative factors.
And Dr. GK is a surgeon, Ayurveda surgeon. He operates after allopathy, does 3-4 surgeries. So I think he
So
operated.
that's what I told, that fistula in particular disease, there is no 100% sure shot treatments, particularly sphincters involves there, anal sphincters involves. When anal sphincters involves, so surgical, even surgeons knows that this is a 50-50 chances, there may be a possibilities of recurrence. Then once before going surgery only, when patient comes to first time Char Sutra, means it is a sure shot treatment, 100% we can get out of that disease.
Even WHO recognized Kshar Sutra treatments for fistula, because in allopathy system is surgery done. So after that, again patient may get recurring possibility is there. But in Kshar Sutra, if a patient administered, definitely there won't be any kind of reoccurrence.
And one thing, by getting patients, particularly fistula and low back ache, neck pain, these abroad, from abroad all the way, Canada, Australia and Lebanon, even African countries also, we are getting patients, particularly fistula cases and spinal cases.
We are maintaining standards. Like even NABH also given Ayurveda standards, protocols, standard protocols are there. We are competing with them with our quality.
And one thing, all insurance are accepted in Triyog Ayurveda hospitals. Whoever are taking treatment, they can claim back, they can reimburse that. This is the first of its kind in Ayurveda.
His question was Shankar Netralaya is there, Agarwal also is there, Vasanekar also is there. That's what you are saying.
No.
Institution wise, clinics, Arya clinics,
Small
small clinic. Now, Dr. JK normally will have a patient will be admitted for 15 days treatment. So we have a rooms in Anna Nagar now. Patient will stay there and get the treatment done and get relieved. So clinic wise, you cannot provide the inpatient facilities. We have inpatient facilities here and Anna Nagar, even in all other 3 locations.
In Hyderabad, we are having 15-bedded facility.
Each location.
Each location. In Visakhapatnam also, we are having 15-bedded facility. Center of the city.